Chapter 11 focuses on the connection between diet and health. So basically this chapter is going to take everything that we've learned so far about nutrition and connect it with how this impacts your health. Can a well-chosen diet protect you from developing a disease? Well, it kind of depends. There are two types of diseases. They can be infectious, which is something like influenza or tuberculosis. Antimicrobial drugs can help to decrease the death from these types of diseases. But there's also chronic diseases, and these are things like diabetes, heart disease, obesity, that you don't catch these things like an infectious disease. Chronic disease can arise from genetic inheritance, having prior or current diseases, and then lifestyle choices, including diet. And if you think back to the very first week of the semester when we talked about the leading causes of death in the United States, 4 of the top 10 leading causes of death are diet-related. So this right here, these lifestyle choices, can very much promote the development of chronic diseases. And that's what we're going to talk about this week. Starting with malnutrition. So malnutrition and diseases really worsen each other. It's this really destructive cycle as malnutrition, which can arise from starvation or obesity, so not having enough food or having too much of the wrong types of food, can worsen a disease. And then the worsening of this disease, in turn, continues to worsen the malnutrition. So it's really this destructive cycle, which is not beneficial by any means. During malnutrition, immune systems or immune tissues are the first tissues that are going to be impaired from both vitamin or mineral toxicity or deficiency. And again, this can arise from starvation, so not having enough of a certain vitamin or mineral, or obesity when maybe an individual has too much of a certain vitamin or mineral. There are several risks that are there are several groups that are at risk for malnutrition specifically. These are going to be people who restrict their food intake for a variety of reasons. So it could be due to lack of appetite. Maybe they have cancer, or they're just another sort of illness that is causing a lack of appetite. People that have eating disorders, they are consciously restricting food intake, or individuals that have a desire for weight loss. Very young and very old individuals are susceptible to malnutrition, and then individuals that are hospitalized are also at the greatest risk for malnutrition. So how does the immune system relate to chronic diseases? Whenever there is an infection or an injury in the body responds or the response includes inflammation. And we can have both acute or chronic inflammation. So acute is short-term and chronic is long-term. So in acute inflammation, white blood cells are going to rush to the site of infection, and they're really trying to get rid of whatever is causing the inflammation. So the white blood cells provide this oxidative defense to help heal the injury or wound or whatever is going on. So this is a normal process and it's very beneficial. However, if this goes on over time or when acute inflammation persists long term, this can actually cause harm to tissue and worsen the disease. So while immune response is very typical and normal, if it continues too long and we have this chronic state of inflammation, this can be detrimental to health. Moving on to talking about risk factors. So what are risk factors? Risk factors are factors that are known to be related or correlated to certain diseases, but they're not proven to cause a disease. So there's just an association or relationship, but there's no causal relationship or causal proof that these two are related. It's just a correlation. Disease risk factors include things like genetics, environmental risk factors, so maybe where you live, is it pollution related, and the behavioral or dietary risk factors. So behavior, like I choose to exercise or I choose not to exercise, versus dietary, like I choose to eat whole grains or I choose not to eat fruits and vegetables. So all of these can be related to increasing or decreasing one's risk for certain diseases. So different diseases may have different risk factors. So some risk factors may go across the board, as we'll see in the next table, but some disease risk factors are very specific for each disease. How do you estimate your own disease risk? You want to look at your family history because there is that genetic component of many diseases, and we'll talk about this as we go on through the different segments this week. But it's also important to get your lab results because this can give you a true picture of what your health really is. So lab results are going to be things like your lipid panel, so your cholesterol, your triglycerides. Do you have high blood pressure? What else is going on with your body? So having that complete picture of family history and lab results can help to reveal strategies that will help with disease prevention. So this table here shows the different risk factors for various chronic diseases. And you can see the different dietary risk factors and then other risk factors and which diseases they're related to. So you can see that diets that are high in salt may not necessarily increase the risk for atherosclerosis as much as they do hypertension. Some of these, again, are modifiable. So our dietary risk factors are all modifiable, meaning we can change those. So you can choose to eat fewer added sugars. You can choose to eat more fruits and vegetables. We can't change our age, unfortunately. Environmental contaminants are somewhat modifiable, so maybe your water is contaminated, so you drink bottled water, or if you live someplace else where there's a lot of pollution, what can you do to prevent that? Genetics are also non-modifiable. We can't change that. Sedentary lifestyle we can change, as we can also change smoking and tobacco use, and we can also help to manage our stress levels. Finally, in this segment, this picture is just representing that there is this great interrelationship among many chronic diseases. So some chronic diseases can lead to the development of others. Most notably here, obesity, especially abdominal obesity, or that central adiposity, which is at greatest risk for some other health factors, or it has a negative impact on our health, can promote the development of type 2 diabetes, atherosclerosis. Those two can then develop hypertension. Obesity itself can lead to the development of hypertension, and then these two can lead to stroke or heart attack. And then obesity is also related to the development of some cancers. So you can really see this relationship. So we're going to talk about several of these chronic diseases in our upcoming segments this week, and how we can help to decrease our risk factors, prevent the development of these diseases, or manage them once they have developed. So we'll see you in the next segment.